here we are at IGS, and what these guys are doing is literally revolutionizing medicine. I'm being joined by Dr. Levada and Dawn Anatra. Welcome, ladies.
Welcome, thank you.
Thank you.
All right, so let's start with you, Dawn. What is it that your company does?
We're the first company in the world that actually figures out mathematically how to test someone's body chemistry and DNA. And once we do that, it goes through our algorithm and we calculate the exact amount a patient should be on based on their mutations. So we start with the hormonal level, down to the pre-hormone, down to the nutraceutical, and that's all compounded for the patient in exact measures. So you look at it as personalized medicine, that next step. However, we never leave the doctor out. We're a software tool for the physician, not for the general public. This stuff is way too important and complicated not to have the doctor sort through it.
I got it. Okay, so you're basically a tool, like you said, for the doctor. And so somebody may go to a doctor like Dr. Levada, and Dr. Levada runs this program on them, and they get the feedback from you. Mm-hmm. Talk about that.
Get the feedback from me, all right. So, health is a journey to the best our body, our mind, and our spirit can be.
Right. So okay. we're all given genetics,
okay.
And then we got to take it from there.
Optimal chemical balance is based on every individual has their own specific genetic levels of hormones and pre-hormones and proteins and enzymes that our bodies depend on every single moment of every single day to regulate everything that we do.
Gotcha. Okay. So walk me through this. So you get this report from Dawn's office, and what do you do with it?
IGS is the software and the venue where, because of aging and stress and trauma, this balance goes off. IGS focuses on putting the individual back to their optimal levels based on their genetics. So, right now, without IGS, a doctor will not treat a patient unless they're out of the normal. And that treatment is going to be a standardized shotgun, one-dose medication.
One size fits all.
One size fits all that never takes into assessment their genetics, and it might kill them instead of helping them. So IGS, because we know much more about DNA and genetics, it's revolutionizing medicine, and IGF is going to transform healthcare to personalized treatment tailored to the individual and their genetics to ensure that they have a better, longer, more fulfilled life.
I love this. Okay, so what you're telling me, and we talked a little bit yesterday, is that as you were talking about the one shot, the one size fits all approach doesn't always work because somebody may not absorb things the same way somebody else does. So it toxifies them.
Especially when the medication has a narrow margin between therapy and toxicity, like chemotherapy.
Gotcha.
If the doctor doesn't know that genetically you're a poor metabolizer of that molecule, and he's going to give you the same dose as he is doing to your neighbor because he's the same height and weight, that may kill that patient not knowing that they're not metabolizing it. They'll overdose them. This is where it's important, and it's going to change. And any doctor who's going to administer chemotherapy is going to have to do genetic testing.
I love this idea. I think it just blows my mind. It's so revolutionary. Dawn, let's talk about this. How did IGS come about? What was going on that you guys said, hey, we can use this to facilitate that? Talk a little bit about the story.
I think, our founder, he medically had his own problem he was dealing with, and he went from doctor to doctor, and no one can help him. And, he hit upon a doctor similar to Dr. Levada, more integrated doctor, thinks out of the box, started very good with hormone replacement, started to feel a little better, but he said, this does not make sense. I'm unique to the next person in the room, it can't be the same thing. So he's a mathematical genius, comes from the financial world, spent 3 years perfecting this algorithm, and hence it was born. We've seen the most amazing things happen with patients. Look at it this way, is everyone a size 32 pants?
No.
No. So why would you all take the same medication, supplements? There's so much of a combinatory effect. So each level of something affects the next. Your hormones affect your pre-hormones affect your nutrients, and your genetics play the largest role in all of that. So it makes perfect sense, and what we've seen in results of patients have been really pretty amazing. Pretty amazing things have happened.
Yeah, you know what, and even though you might have 1 million people that are wearing a size 32 pair of pants, they're different lengths,
Yeah.
right? And all those different things that go into play. So talk about some of the success stories that you guys have seen.
Well, I think Dr. Levada can talk to one that really stands out with someone who had anxiety.
Yes, she's a woman in her late 40s, early 50s, who is a successful woman and a good job, no emotional issues, except she came to and has been to many different doctors and has been treated with a lot of different medications for anxiety, for a little depression, but the medications not only never helped, they made her feel worse. So when we saw her and we did the blood work and her genetic analysis, it showed that she had a defect in the COMT, which affects her serotonin and her dopamine levels. And so these medications, these SSRIs like Prozac or Zoloft, are contraindicated in her. They can make her suicidal, and no one knew that because they didn't know about her genetics. So we put her on the program that was calculated by taking into account all her results through this software system, which is phenomenal. And at the 3-month follow-up, when she came to me, she said, "I will be your poster child. For the first time in my life, I wake up without dread, without anxiety." She was besides herself. It was like magic. No more dread, no anxiety, no medication except for the natural supplements that we put her back into balance.
That's a fantastic story. And you know, and what amazes me about what you just said is every drug that you see marketed on TV says, hey, we have a gazillion list of side effects, possible side effects. Right.
Third leading cause of death in the United States, drug interactions or reactions.
So, and I'm thinking,
Metabolizing them.
right. That's exactly what I'm thinking.
So
that
look like this. It goes through the PY450, right? And then there's all pathways in there, right? If you have a roadblock, it's not getting through. So you're building toxic levels. And you keep taking it every day and you're building more toxic levels and more toxic levels. It's a simple blood test, swab test, find out what is suited for you. It just makes perfect sense.
all right. And so how long does this test take to get back? So you do a quick swab test and it takes a week, a month? Okay, 2 weeks. That's
2
pretty
weeks,
quick.
yeah. 2 weeks and then, a little bit quicker, but I like to say 2 weeks.
And 2 weeks is still pretty good. Yeah, I
Yes.
like that.
And
Okay, so where can people find out about either Med Spa or IGS? Talk about yours first.
Well, we're prismmedspa.com and DNAunleashed.com.
DNAunleashed.com, medspa.com. Dawn, what about you?
IGScode.com.
IGScode.com, revolutionizing medicine and revolutionizing how people heal. I love this idea.
And it's the wave of the future. Of course, medicine is going to change. It's going to have to change, and we're going to have to go in and introduce this to physicians because they can't continue to treat patients without having this information.
I love it. You know what? I cannot wait to follow up with you guys in a couple of months and see what great things you guys are doing. It's been a pleasure having you on the show today.
Thank you.
Thank you.